My name is Dr. Matiko Diabe, the County Director of Medical Services, Kisii County. Today we are here with our partners from the Ministry of Health and our partners from CAWE to launch a very important campaign for us that focuses on stigma for those who live with epilepsy, as something that we want to overcome as a county government, but also an emphasis that has been brought forth by our partners as earlier mentioned. Epilepsy in this country, Kenya, is rated at a prevalence of around 16 to 20 people per thousand Kenyans in the whole country, and it's a problem that has received multifaceted interventions. Partly being focused on availability of medications, specialists, and congresses to discuss on new approaches on how to manage patients with people living with epilepsy. Unfortunately, in all this, there's a key component that has not been addressed that makes our patients or those who live with epilepsy shy to come and get the medical services that they need, and this is the issue of stigma. In our communities, and specifically here in Kisii, we have many of these patients who should be accessing service, but they do not come for the fear that they'll be labeled in their communities. We have beliefs that those who have epilepsy have been bewitched or they are possessed by some spirits, and that makes it difficult for them to come forth for these services. Today, with our partners, and specifically within our Kisii County, we are launching a campaign that's going to make people aware that epilepsy is a disease like any other disease that is manageable.
Ni mkurugenzi mkuu wa shirika la CAWE. Tumekuja hapa Kisii kama vile director amesema to launch a campaign inaitwa Curse of Stigma. Tumekuja hapa juu Kisii is one of our special counties because we have a very good relationship with the governor, His Excellency the Governor, and the whole team at the CHMT. Tuko na ushirikiano mzuri sana. We have numbers that justify us coming here. Kisii, kama vile director amesema, we have patients that are still not coming out to seek for treatment, and that is why we have this campaign that is coming off a documentary that we did earlier in the year, last year. We launched it in Dublin, Ireland, to help women or to understand how women live with epilepsy. And that is what we are trying to do here in Kisii County. CAWE is a 42-year-old organization.
I'm Emmanuel Kisii from the Ministry of Health and Division of Non-Communicable Disease. I'm here today to represent our division head in this Kisii County as we launch this campaign that we are going to talk about the stigma that has been associated with epilepsy in the country. So we are honored to partner together with CAWE and the county government of Kisii on this. As a ministry, part of our responsibility is to provide technical support to the county government. We also tasked with the policy development.
In fact, the World Health Organization has had a target of 90, 80, 70, that by the year 2031, we reach 90% of those who have epilepsy, but put 8% of them on treatment and make sure that we achieve control in about 70% of those people. But we cannot achieve this if we continue having this issue of stigma. And that's why today, as a department and with our partners, we are coming forth to have a discussion among healthcare workers, patients themselves, and the management that will then lay down policies and strategies with a roadmap to ensure that we get those targets. So mine today is to make a call for the residents of this great county of Kisii that if there are patients or people living with epilepsy within the environments, come forth, bring them. We have the relevant specialists in our facilities that will ensure that they are taken care of. Good news is, for most who come for regular checkups, we are able to control this epilepsy. And sometimes, if we achieve control for a period of about 3 years, we are able to start withdrawing some of these medications to see if these patients can then live off medications. But if we don't bring them forth, then that becomes really difficult to assist these patients. So as we launch this campaign and we'll be seeing us in your various setups, please communicate to those who need this help to come forth. As a county government and on behalf of the department and indeed that of His Excellency the Governor of this county, Simbarati, we are committed to allocate the relevant resources that will go towards making sure that we take care of these patients once they come forth. Further, we'll ensure that this campaign, even beyond this launch, is sustained to ensure that the message then reaches even new cases that are identified and they are taken care of within our great facilities and at local facilities where they live.
Trying to address issues of people with epilepsy for all those years. We have quite a number of patients in Nairobi. We have 3 clinics in Nairobi. We work very closely with the county governments, especially the county government of Nairobi and other county governments across the country. We have 3 clinics with almost about 17,000 patients with epilepsy, and that's quite a big number. So we are here in Kisii to see if we can help people come out of the shadows, stop being afraid about epilepsy, we reduce the stigma, and we improve the treatment gap. Director has said that the treatment gap now in Kisii County stands almost at 80%. And that means that out of 10 people, only 2 people are able to access healthcare facilities. So 8 people go to seek interventions with the witch doctors, traditional healers, pastors, na hiyo maneno mengine. So our clarion call hapa Kisii na ile maneno mengine tutafanya hapa after this launch. Our clarion call ni kusema kifafa si uchawi. And I say that deliberately and I'll keep repeating that kifafa si uchawi. Kifafa si kurogwa, hujarogwa. Kifafa ni kama ugonjwa mwingine yoyote na unaweza pata matibabu ukikuja kwa clinic na ukipatana na daktari atakusaidia upate madawa alafu uanze kuendelea na maisha yako kama mtu mwingine yote.
I'm a patient with epilepsy. Julia ni mama ambaye amelewa akiwa mzima mpaka the age of 50. Ndio nikapata niko na ugonjwa wa kifafa. Wakati nimepata kifafa, nilienda hospitali nikashughulikiwa, nikapewa madawa, na hayo madawa madaktari wakaketi pamoja na familia yangu, wakawaelezea shida ya mama, wakaielewa, wakaambiwa madawa mama anaenda kuchukua inastahili aikunywe kila siku. So ikawa ni jukumu la familia to ensure that I take my drugs daily and timely. I want to take this opportunity to thank my family for working with me with my condition. They have supported me in all ways to ensure that I'm stable. And of course I'm stable. By profession I'm a nurse. I'm the deputy nurse manager of KTRH. I think the people I'm working with in the office, they do understand my condition and they are able to support me from every angle. Together with management of KTRH, they understand who I am and we are able to work. At this juncture, when Kawa is coming in to support the people with epilepsy in Kisii County, I feel great. Now that we are going to pass the information to the community to make sure that the people who are living with epilepsy know that epilepsy is treatable, it's manageable, and you can live normal life while you are suffering from epilepsy. So far, I want to thank the Kisii County for allowing Kawe to step in, the Ministry of Health, for allowing Kawe to step in and work with us. Our people, it is high time that we bring out our people who are suffering with epilepsy,